Indiana Newsdesk is made possible in part by Smithville Fiber Internet, streaming TV, home security and automation in Southern Indiana. More information at smithville.com. Maller Grodner Attorneys, providing legal services to clients and the community. Understanding, expertise, results. Bloomington and Indianapolis. lawmg.com. IU Alumni Association, connecting IU's network of alumni and sharing the Indiana spirit through scholarships, advocacy, and volunteerism. alumni.iu.edu. IU Center for Rural Engagement, extending IU Bloomington resources to improve Hoosier lives in partnership with communities and organizations. rural.indiana.edu. And by WTIU members. Thank you.
Coming up on Indiana Newsdesk. The governor says he won't issue a mandatory mask order despite increasing cases and hospitalizations.
Really up to us to take responsibility for our own actions and the way that we conduct ourselves.
The governor is delaying the state's reopening plans because of the surge in cases, but is that enough? After a 17-year hiatus, the federal government resumed executions in Terre Haute.
That we are not the ones who can say whether a person lives or dies.
Our Adam Pinsker was selected as a media witness for the executions. Ahead, he joins us from the federal penitentiary. The People Black activist Vaughxx Booker, accused of attacking him over the 4th of July weekend near Lake Monroe, share a very different account of what they say happened. Coming up, the latest on the investigation into what Booker alleges was a near lynching. Those stories, plus the latest news headlines from across the state, right now on Indiana Newsdesk. Welcome to Indiana Newsdesk. I'm Joe Wren. We're following several big stories tonight, including new charges in the reported assault that happened at Lake Monroe over the 4th of July weekend and the resumption of federal executions after a 17-year hiatus. But first, the latest on the coronavirus pandemic. COVID-19 infections are surging in Indiana. The state is averaging more than 600 new positive cases each day. A number of other metrics the state uses to gauge how the virus is spreading are also up. The state's health commissioner says she hopes the numbers push Hoosiers to comply with best practices to slow the spread of the virus.
I do feel like it is a time for Hoosiers to decide that they are going to go back to more careful social distancing and to wear their masks.
Indiana was set to move into its final phase of reopening this weekend. The governor announced Wednesday that it's going to be at least another 2 weeks before that happens. In addition to keeping current restrictions in place, the state will require organizers of any event with more than 250 people to get approval for their COVID-19 safety plans from local health departments.
The capacity levels will stay the same, but how we approve events is going to have that local component as we work our way into the fall.
Holcomb still won't impose a statewide mask-wearing mandate. Instead, he's allowing local governments to make those decisions. Health experts expected numbers to go up when bars and restaurants started reopening. So is the increase really a surprise and something to be concerned about? Dr. Peter Emby, the CEO of the Regan Street Institute, joins me now to help make sense of some of this data. Thank you so much for being on the show. You know, there's a lot of data that's being collected about COVID-19. It quickly kind of starts to turn into number soup. At Regan Street, you're mining through a lot of these numbers. Can you tell us what you think are the key metrics that we really should be paying attention to?
Sure. Yeah, you're right. There is a lot to go through, and it can be complex, so I'll try to do that. We certainly keep an eye on the testing rate. The degree to which people are testing positive is an early indicator. And unfortunately, as has been indicated, we are starting to see that go up. In addition to that, we are tracking the information about emergency room visits, hospitalizations, the degree to which people are not only going to the hospital, but going to the intensive care unit, and ultimately deaths. All of those latter factors actually do lag. And so the earliest signs really have to do more so with what's happening in testing, and we are seeing those go up, unfortunately.
The numbers show us that more young people are testing positive for the virus. What do those numbers look like, and how do we account for that shift?
Yeah, good question. So early in the course of the epidemic here, we started to see numbers in the, let's say, 20 to 40 age group, more in the 20 to 25% of all of those that were positive. What we're seeing now is about half of those that are positive are in that younger age group, likely related to the fact that early on we did achieve success by restricting activity and restricting people's getting around because of the closure. And now, as we've started to go into the summer, of course, we all hoped that things were going to stay low. I think what we're starting to see, unfortunately, is the consequence of more people interacting with one another without taking the kinds of precautions that we need to be taking around mask wearing and other activities that the governor and the commissioner have talked about. And I think that's really critically important. The early signs we're seeing of an uptick, mirroring what we're seeing across the rest of the country, I think is a warning sign to us here in Indiana to take things much more seriously and really get back to being vigilant about doing that kind of social distancing, wearing our masks, and being careful.
So as you say, more people testing positive for the virus, but the deaths aren't as high right now. How does this compare to what we were seeing in March and April, and why do you think we're seeing that change?
I think there's a couple of reasons. Early on, we did see a higher number of infections happening in the older population and the population that was actually more likely to die, unfortunately. Now, because the younger population is getting infected, there's probably two reasons, Joe. One is that the younger people are less likely to actually end up being in the hospital and dying. But there's also a lag. It's often the case that it takes a couple of weeks after we start to see an increase in cases before we will actually see those deaths. So I don't think we're out of the woods yet. My hope would be that we wouldn't see the numbers we saw back in March and April, but I think now is the time to take precautions to keep that from happening.
All right, Dr. Emby, we're out of time. We'll have to leave it there for now. Thank you so much for being on the show.
Thank you. Pleasure.
Hospitals and healthcare systems are facing huge losses because of the coronavirus pandemic. It's being felt especially hard in rural areas. While Good Samaritan Hospital in Vincennes received more than $16 million from the federal government, officials say that doesn't account for all their losses. Brock Turner has the story.
Data from the Indiana Hospital Association shows rising drug costs, purchasing additional personal protective equipment, changing operating procedures, and serving fewer patients overall has cost Hoosier hospitals tens of millions of dollars. Good Samaritan Hospital in Vincennes was forced to furlough about 200 workers because patient volumes were down 50% during the heart of the pandemic. While officials there say many are back to work and volumes have returned to near normal levels, Good Samaritan still faces an $18 million budget shortfall.
We made a lot of tough decisions. When we shut everything down in March 18th, to be specific, we recognized that we weren't going to be able to maintain the level of body count that we had before with no volumes coming in.
The system's finances before the pandemic weren't great either because of the way service reimbursement is structured.
You need to keep up with your technology and keep your employees paid competitively. All those things are a struggle with us every single day.
Data shows hospitals across the state averaged a negative operating margin of more than 8%. But the real struggle came in rural communities with critical access hospitals. Indiana's 35 critical access hospitals, many of which were already struggling, reported spending nearly 30% more than they made since the pandemic began.
If some of these small rural hospitals or even some of our urban safety net hospitals, if they start to falter, there isn't that same level of strength there.
Tabor says if action isn't taken to help these facilities, more cuts and closures will be inevitable. For Indiana Newsdesk, I'm Brock Turner.
In addition to lower patient volumes, hospitals reported paying 10 times more for masks. At Good Samaritan Hospital in Vincennes, workers were using one box of N95 masks per month before the pandemic. Officials there now say they're using 90 boxes per month and still deal with supply shortages of PPE and testing supplies. Well, Indiana faced a $900 million hole in its finances in the fiscal year that ended last month. The state is covering its shortfall through cuts to state agencies, federal help, and its budget reserves. The state can also still collect money from a delayed tax day to assist with the new fiscal year starting July 1st. But the state's budget director says the future still looks cloudy, and the state needs to move forward with that in mind.
To not only meet and deliver sound services to our citizens, but then the ultimate outcome after that is to restore the reserves.
Officials said state agencies were able to save money by leaving vacant positions unfilled and renegotiating contracts, not by cutting services. Well, the state will stop issuing an additional $600 to recipients of unemployment benefits next week. The $600 expires at the end of the month due to a provision in the Federal CARES Act. Unless Congress provides additional relief, the maximum Hoosiers could get in unemployment assistance would decrease to, at most, $390 per week. Coming up next on Indiana Newsdesk. The Monroe County prosecutor is charging 2 people in the reported fight that happened at Lake Monroe over the July 4th weekend. Coming up, the latest on the case. And advocates call a new rule banning transgender students from enrolling in one of the state's nearly 70 Catholic schools harmful and dangerous. These stories and more right here on Indiana Newsdesk.
The WTIU WFIU news team connects Indiana to the world. We bring you the top news of the day on radio, TV, and online. We round up the stories that have people talking each week and dig deep into the issues that affect your community the most. The WTIU WFIU news team is where you are and telling your story.
In a time of change, where can you find in-depth reporting and thoughtful analysis? Washington Week on PBS. Join moderator Robert Costa.
When I was at the Capitol this week, I encountered the same.
And a panel of award-winning journalists.
You're seeing a divided nation, and you're seeing.
For insights and perspective.
Tonight there was a key development in the
Senate. You won't find anywhere else.
What a week.
Washington Week.
Welcome back to Indiana Newsdesk. 2 men are facing charges after Vaughx Booker, who is black, accused a group of white men of assaulting him near Lake Monroe over the July 4th weekend. Now, video clips that captured part of the incident show several white people surrounding Booker, who's down on the ground in a wooded area. Another shows a shirtless white man shouting racial slurs at the person recording. The videos went viral, amassing millions of views on Facebook and triggered a series of protests in Bloomington. My colleague Mitch Legan has been closely following this case, and he joins me now from the newsroom with the latest. Hi, Mitch.
Hey, Joe. Yeah, we had quite the shakeup this morning when the prosecutor's office sent out the news release with the charges. We received the 68-page DNR report last night, and I read all of it, so it's been quite a whirlwind. But according to the release, Erica Oliphant, the Monroe County prosecutor, is charging Sean Purdy and Jerry Cox. Purdy's the one in the red shirt in the video, and Cox is the big guy with the tattoos. Purdy's being charged with criminal confinement, battery resulting in moderate bodily injury, and intimidation, all of which are felonies. Cox, on the other hand, is charged with aiding, inducing, or causing criminal confinement, and battery resulting in moderate bodily injury, which are both felonies. He's also facing misdemeanor charges of intimidation and 2 counts of battery.
So you mentioned that DNR report released yesterday. I haven't had a chance to go through all of it, but your story on it last night said they listed a series of charges. Vaughx could face 2, but Oliphant isn't charging him with anything.
Yeah, so the big thing that jumped out to me was the fact that the DNR basically suggested charges all around, including against Vaughx Booker. It listed 6 potential crimes that occurred that day, 3 by Purdy and Cox and 3 by Booker. When we spoke to Vaughx last week, he said he was walking through public land and the incident occurred on public land. According to the report, he could have been charged with criminal trespass for going onto the McCord property after he had been told it was private property and asked not to come back. He could have also faced 2 charges of misdemeanor battery, one against Purdy and the other against Cox. And I should mention here that Purdy's side claims Booker started the incident, getting in the face of Purdy's girlfriend and the property owner, Caroline McCord. Purdy says he stepped in between the two, and Booker punched him 3 times. They claim Booker was being restrained when the cameras started rolling because they were worried he'd start swinging again.
So was there anything in the report about a noose?
So as I said, kind of at the end of that last segment, people backed up both sides of their group's story. Those who are with Vaughx said they heard someone call for a noose and told everyone to leave so they could hang him, while those with Purdy say that never happened, and they were just restraining Vaughx because they thought he was going to keep allegedly punching people. One thing that I should mention is that according to the one officer's report, Vaughx wasn't the one who brought the noose up. One of his friends said he had heard someone call for a noose, and I'm going to read the report here verbatim. Quote, Mr. Booker then stated that he heard the same remarks but had forgot about them earlier, end quote. Another thing I'll mention is Purdy was wearing a Confederate flag hat. There was some uncertainty online about Vauxx's claim that people were wearing Confederate hats. There are no stars and bars visible in the video he shared. But Purdy told the DNR officer that he thought Booker came back to their property because he didn't like Purdy's hat.
Okay, so the Monroe County Prosecutor's Office has filed charges, but the FBI has been investigating the incident as a hate crime. Does this impact that at all?
No. So the FBI investigation is a federal investigation, and the DNR one is state level. So they're unrelated. I spoke with Booker's attorney, Kitty Lyle, this morning, and she says the FBI investigation is important because an agency is investigating it as a hate crime.
Really quick, have you gotten a chance to speak to the attorneys for Cox and Purdy?
No. So the Associated Press reached out to David Hennessy, who's representing Purdy, and he had no comment.
All right, Mitch, thank you very much.
Thank you, Joe.
Nationally and in Monroe County, some activists are pushing to defund law enforcement. But Monroe County Sheriff Brad Swain says 99% of the county supports his office. Ethan Burks has the story.
In Bloomington, protesters have marched while chanting "Defund the police" on several occasions since the killing of George Floyd. During local government town halls and discussions, citizens have repeatedly talked about their mistrust of law enforcement. But during this week's Monroe County Council meeting, the other side of the issue came forward in support of the Sheriff's Department.
I think that it's a completely ludicrous idea, this defunding. It's becoming the new trend, but I think it's not really rooted in much logic or any real merit.
I implore you not only to avoid any defunding, but to increase funding if possible.
I've needed them. They've been there. They're kind. They're gracious. They go way above and beyond what they're paid to do.
The defunding conversation really took off in early June when the Monroe County Sheriff's Department proposed hiring 2 new deputies.
There was a vocal minority that decided to make an issue with it, and they are not new positions. They were filling vacant positions.
It was bad timing. The proposal came less than a week after the killing of George Floyd, but since then, Swain says the 2 positions have been filled. Councilmember Kate Wiltz says in recent weeks she's received hundreds of emails from people who support the Sheriff's Department and want it fully funded. She says she agrees that defunding isn't the answer, but the county government can't ignore systemic bias when it comes to race.
We need to commit to identifying and addressing policies and power structures that are working in favor of white people and creating barriers for Black, Indigenous, and people of color.
The council says it doesn't plan on passing any legislation that would immediately defund the Sheriff's Department, but it will be working with them in the coming months on the 2021 budget, which will formally be discussed in September. For Indiana Newsdesk, I'm Ethan Burks.
The U.S. government resumed federal executions this week. The first inmate to be put to death was Daniel Lewis Lee on Tuesday, followed by Wesley Ira Perkey on Thursday. The third federal inmate scheduled to die is 52-year-old Dustin Honkin from Iowa. Iowa abolished the death penalty in 1965, but federal prosecutors sought that punishment against Honkin because of the horrific nature of his crimes. My colleague Adam Pinsker was selected as a media witness to this week's executions, and he joins me now from outside the federal penitentiary in Terre Haute.
Well, Joe, the execution chamber here at the U.S. Penitentiary is above my right shoulder between that water tower and tall red brick building. The United States Supreme Court in 2 of these executions ruled 5-4 that they can proceed, so this has become a very divisive issue. William Long and Abe Bonowitz came to Indiana from 2 different parts of the country with different perspectives about the death penalty. From outside the secure fortress-like walls of the United States Penitentiary in Terre Haute, Bonowitz and his group Death Penalty Action arrive hours before the scheduled execution of Wesley Perkey.
Very few people are paying attention. We're here to pay attention and to say more than half the country, according to Gallup, more than half the country considers the death penalty to be immoral.
William Long proudly considers himself among the half that thinks the death penalty is moral. He was there watching Perkey receive a lethal injection early Thursday morning, 22 years after he raped and murdered Long's daughter, Jennifer.
There's some resolve. There is no
There is no closure, never will be, because I won't get my daughter back.
As if waiting 2 decades wasn't bad enough, Long waited in a van for 4 hours outside the execution chamber Thursday morning, while Perkey exhausted all his last-minute appeals before being allowed to enter and witness the execution.
There's way too many delays, too many putting in for appeals, and it needs to be re-scrutinized.
Back outside the prison walls, Bonowitz tells us that if anything, there needs to be more judicial scrutiny in capital cases.
Especially with what happened to Daniel Lee. When he was finally executed, there were still legal motions pending. His attorneys were not even advised in advance that he's about to be executed.
Bonowitz believes the Trump administration deliberately scheduled 3 executions in 1 week of inmates who committed heinous crimes because it would bolster the president's re-election hopes.
This government is willing to just do whatever it takes to follow the orders of our president.
But if you listen to William Long, he'll tell you how agonizing it was to wait all these years before justice was given to Wesley Perkey.
And then 17 years he sat on death row, and every day for the rest of my life, I will think of it, I will remember it, and it's not something any parent should have to live through.
A 4th execution is scheduled for the same facility on August 28th. Now, only the Attorney General and the President of the United States can grant clemency to anybody who's condemned to die in the federal system. The death penalty issue generating a lot of controversy. There's some protesters out around the prison all week, and a lot of them say that the federal government shouldn't be doing executions because of the COVID-19 pandemic. In fact, one inmate here at the prisons died from COVID-19, and some staff members have come down with it. So, and with unemployment hovering at 11%, they just feel like it's not an appropriate issue that the government should be focusing on. Joe, back to you.
All right, Adam, thank you. The Catholic Archdiocese of Indianapolis is banning transgender students from attending any of its schools. LGBTQ advocacy are denouncing the policy and calling it harmful to young people. The policy could affect students in 60 schools across southern and central Indiana.
During a protest in Indianapolis, cars circled 2 full blocks to show their support for transgender students. The guidance from the Archdiocese says if a student or parent works to legally change the student's gender or chemically or surgically alter the student's given biology, the student will be requested to withdraw from the school. Katie, who didn't provide her last name to protect the identity of her daughter, says that now excludes her family.
Lizzie will be a freshman in the fall and is unable to go to the school my siblings and I attended. This is a school where she was baptized, received her first communion and reconciliation.
The diocese operates schools in nearly half of the counties in the state. Former Roncalli guidance counselor Shelley Fitzgerald says the policy is devastating for transgender Catholic students who now don't know what school they'll attend for the fall, or if they choose a Catholic school, how they'll be received.
And this isn't just, a singular event that's happening in the world. I mean, this is happening all over the place, and we need to protect our trans population and specifically our trans youth.
The policy also states that students will have to use the restroom and locker room that corresponds with their biological sex. And school personnel will only address students as the name listed on their registration information and the pronoun that matches their biological sex.
The Gay and Lesbian Alliance says the Archdiocese's policy to exclude young people rather than create a safe environment for them is, quote, shameful and dangerous. Well, Wish Upon a Wedding is a nonprofit organization that grants weddings and vow renewals to couples facing serious illness and life-altering circumstances. At the end of 2019, the organization granted its 50th wedding to an Indianapolis couple, Chris and Vanessa Blake.
Last year, just before Christmas, Greenwood residents Vanessa and Chris Blake renewed their marriage vows at the downtown Indianapolis Arts Garden. To anyone passing by, the wedding festivities and preparations look typical for a couple on their wedding day. But the celebration is bittersweet. Vanessa has ALS, and she and Chris decided to renew their vows with Wish Upon a Wedding because of their circumstances.
This was a moment of a lifetime that I got to share with the love of my life and my other love of my life, which was my daughter.
In the midst of all the pomp and circumstance of the ceremony, a painter sits towards the back, capturing Chris and Vanessa's moment on canvas. Vanessa says this is just one example of how Wish Upon a Wedding took care to personalize the wedding for her and Chris. The organization interviewed the couple about their hobbies and passions so they could be incorporated into the wedding details. Before being diagnosed with ALS, Vanessa was an avid painter.
And I told them I loved to paint, and that was something when I was stressed or sad or going through a rough time that always brought me comfort and centered me and brought me peace.
Vanessa says she likes the painting because it captures the love felt that day from family and friends who attended the wedding and does not focus on her being sick. As Vanessa reflects back on the day, she says she's glad they did the ceremony when they did because just 4 days after the ceremony, she was hospitalized. She says if the ceremony were held any later, she wouldn't have been able to walk down the aisle for the vow renewal. Since the initial interview, Vanessa's husband says her condition remains similar, but she's progressively losing mobility. Vanessa and Chris's ceremony was the last one a Wish Upon a Wedding was able to organize before the pandemic. For Indiana Newsdesk, I'm Bente Boutier.
That's the end of this program, but our work continues online as we cover the news throughout the week at WTIUnews.org. Have a great weekend.
Indiana Newsdesk is made possible in part by Smithville Fiber Internet, streaming TV, home security and automation in Southern Indiana. More information at smithville.com. Maller Grodner Attorneys providing legal services to clients and the community. Understanding, expertise, results. Bloomington and Indianapolis. LawMG.com. IU Alumni Association connecting IU's network of alumni and sharing the Indiana spirit through scholarships, advocacy, and volunteerism. Alumni.iu.edu. IU Center for Rural Engagement extending IU Bloomington resources to improve Hoosier lives in partnership with communities and organizations. Rural.indiana.edu. And by WTIU members. Thank you.